So that was terrific. And now we're going to hear from Sue Hankinson. And Sue is at the University of Massachusetts, and she is a giant in the field of epidemiology. So what's epidemiology? It's a way of studying problems in the population. So while many of the researchers here are in the laboratory doing experiments in animal models, people like Sue are out in the world collecting data on patients, observing what happens to them, making connections and associations. And she'll tell you about her work, but I think it's fair to say that the Nurses' Health Study, one of the main projects she's worked on, is really one of the landmark epidemiologic studies of our time that has really explained so much to us about breast cancer and the risk factors that are associated with getting breast cancer. And so we're thrilled to have her here. Sue.
Thank you so much. I'm so pleased to be here. It's been really fabulous. Very nice event tonight. And the meetings are wonderful. To have so many smart people in the room, just from all different arenas, trying to think through all different, what they're doing now and how, one discipline can really help solve another discipline's problem or come up with new questions. But anyhow, so a little bit more about what I do. It is a little bit different from what a number of the scientists do here. Being an epidemiologist, I track large numbers of women over time. I've been a senior investigator with 2 large cohorts for the last 20-some years, and was principal investigator of the Nurses' Health Study for 5 years. And so we follow about 250,000 women. The first study started in 1976, the second in 1989. We follow them every 2 years, asking about lifestyle factors, reproductive factors, all kinds of things, such that we can link their exposure experiences with subsequent health outcomes to try understanding what is the etiology of breast cancer, how can we prevent it. One of the area that I have been particularly interested in has been looking at biomarkers of risk, factors that circulate in the blood or in the urine that could give us some clues to who is at higher risk of developing breast cancer later on. And to study that, I actually asked the women in the Nurses' Health Studies to provide blood and urine samples, and to us, that we socked away in freezers. We had 60,000 women provide samples, and we're now utilizing them to look at markers that were present in the blood 5, 10, even 20 years before the woman was actually diagnosed with breast cancer. Looked at a number of hormones, growth factors, nutrients, lots of different things. Most relevant to the meeting today is that we've looked at estrogen levels and testosterone levels in premenopausal women and have found that there is, a positive association, that women that have higher levels have a slightly higher risk of breast cancer. We've looked at the same thing in postmenopausal women, just looking at naturally circulating hormone levels, and again, found a positive association. There's many more studies in that arena, and so the link is much firmer. And now we're looking at, can we use this information to help guide women and their caregivers to decide whether they should be more active in trying to decrease their risk through lifestyle changes, alter their screening behavior, or consider chemoprevention. But estrogen is also linked to a number of different risk factors that we know about. Body mass index, being overweight or obese, is positively associated with breast cancer. Estrogen is for sure one of the mechanisms. There's certainly others. The use of postmenopausal hormones, alcohol intake, being sedentary is certainly linked to breast cancer, and it may actually have estrogen as one of the pathways that's involved. One of the other things that we've looked at in the Nurses' Health Study is looking at, are there lifestyle factors that women can change to improve their survival if they have breast cancer? And there's been several factors that have come out of our study and a number of other studies throughout the US. Probably some of the best confirmed ones are maintaining a normal or lean body weight and actually being physically active. The data on physical activity is actually pretty strong now, that it does improve survival among women with breast cancer. So those are the types of things I do. We have many other things currently ongoing, and so stay tuned. I'll be happy to take any questions. Thank you.